Hi, it's Dr. Harper. I want to talk to you a little bit more about HSDD. That stands for Hypoactive Sexual Desire Disorder, and about 10% of women report that they have it. It is a medical diagnosis made by a doctor or a healthcare provider, and you have to meet specific criteria in order to have the diagnosis. So just for your education, I want to talk to you a little bit more about what those criteria are. So the first one is a lack of motivation for sex, and also you don't have any responsive desire. So even if you kind of get going with intimacy or sex, you still don't get into it, and afterwards you're just happy that it's over. Or if you have a loss of motivation to participate in sex or initiate sex, finding yourself avoiding situations where sex might eventually happen. So for example, if your partner comes up behind you and kisses your neck or offers to give you a back rub, then you might avoid that situation entirely. Or you might say, I'm gonna go take a shower while you hope your partner falls asleep so that you don't have to have that interaction. So if you meet either of those criteria and your symptoms have been going on for more than 6 months, then you might have HSDD. In addition, this cannot be as a result of pain. So if you're having avoidance of sex because of pain, that's a whole other thing, and we need to figure out why you're having pain and get that fixed, and then see if we can get your desire back. But HSDD, those patients do not have pain with sex. And so if you're having these symptoms, they've been going on for longer than 6 months, you're not having any pain, and this is causing significant distress in your life, then definitely you should consider the diagnosis of HSDD. So patients who have that will report that they are having significant worry. They're worried with their partners. It's causing a relationship problem. Maybe they're feeling depressed or even grief over the lack of a sexual relationship. Then I would definitely encourage you to make an appointment with your healthcare provider so that they can see if you meet the criteria for HSDD. If that's the case, then it's important that you know that there are some medications for HSDD. There's one FDA-approved medication called flibanserin, or ADDY, A-D-D-Y-I, and it's approved for premenopausal women who have HSDD. Another medication that's used commonly is testosterone. This one is not FDA approved, but is usually commonly by physicians for patients who are in their later 40s and on who report symptoms consistent with HSDD. If you're interested to know more about either of these medications, check out the videos and I'll break them down for you. If you think you might have HSDD, reach out to your doctor so that you can see if a medication is right for you.